Welcome to Climate Quickies, bite-sized nuggets of climate goodness from our TEDxLondon experts in under 10 minutes. In this week's Climate Curious, we're looking at how conflict, healthcare and climate intersect with Egyptian physician and the first official Youth Envoy for the UN Climate Summit, Dr. Omnia El Omrani. Omnia shares stories of success, from bringing solar panels to refugee camps to power everyday life, to how the NHS has been taking its oath to do no harm to the next level with its climate plans. Let's head over to Omnia now to hear more. Recorded live at the Oxford's Right Here, Right Now Global Climate Summit 2025. Stay curious.
There's a lot of hope, and there's a tremendous amount of things that people are doing, that we are all doing, and that can be done. And I'm definitely always feel very motivated that there are solutions, not in the future, they are happening now, and they are led by communities from the grassroots, but also many governments are doing a lot of great work. And one great example we always use is the UK, because the NHS is literally the first healthcare system in the world to commit to being net zero. And it's not just about reducing its carbon emissions. Like, the health sector as a whole globally contributes to 3.5% of carbon emissions, compared to the energy sector, which is over 70% or more. But the idea is like, as a hospital, our duty is to do no harm. So we need to walk the talk and reduce our carbon emissions. Similarly, for also people to understand is when you reduce your carbon emissions, so let's say you use renewable sources of energy like solar, or you reduce your waste disposal or change the way that you do that. These focus on the maintenance of medical equipment. Not only does this reduce the carbon footprint of a hospital, it also saves money, and that money can be used to improve the quality of the healthcare services that people receive. So it is a win-win that the NHS is doing and leading a lot of research and implementation in the system. And similarly, many healthcare systems are doing the same, and over 60 countries have committed as part of the World Health Organization initiative to being climate resilient, so to be able to adapt to the impacts of climate, so to have early warning systems, or to be able to anticipate any outbreaks that are coming in, or injuries related to climate disaster, and at the same time to reduce their own carbon footprint. Another great example I love to give, which is an organization I have the privilege to support for many years. It's called Health in Harmony, and they work with indigenous communities in Madagascar, Indonesia, and a few other countries. And what they do is that they went first to the communities, and these communities were doing a lot of deforestation, and they wanted to help them. So, normally you would go to them and do a campaign and be like, don't do that, but they didn't want to do that. They wanted to understand why is the community doing that. And then when they had a lot of consultations and dialogues and hearing from them, they said that the reason they're doing that because they need the money to get the healthcare service that they need, and they don't have any hospitals. It's very remote, it's very difficult. So what they did is that they built in small healthcare facilities and units, and people started reducing their deforestation, and they started being able to protect nature once again. So also giving people the access to healthcare, and also listening to what communities are doing and working together with them. This brings a lot of hope and a lot of action towards climate change. Similarly, in my work at Imperial College in London, we did a set of dialogues to understand the impacts of climate change on mental health. And we did this with over 900 experts in 80 countries. They are a combination of climate scientists, psychiatrists, psychologists, and so on, and lived experience advisors. So many indigenous people, young people, farmers, and fisher people. And one example I've seen connecting also climate and conflict was in Jordan. our partners there, they went to the biggest refugee camp in Jordan, and they realized that they had a lot of power outages, and this put a strain on the community, especially on children. They're unable to go to school, like a lot of challenges that they were facing, and they installed solar panels in the refugee camp to provide them with a consistent, cheap, renewable source of energy. And this has completely transformed the way that people there in the camp are able to function, children going to school, feeling safer in the evening, for women as well. And this is an example of how you're building both the resilience of the people while also protecting and promoting the planet. Last week, I was at the World Health Assembly, which is a conference that the World Health Organization does, and it brings in ministers from around the world to discuss health issues. And I was invited to speak in an event that was led by the Western Pacific region of the World Health Organization. We had two ministers. One of them was from Fiji, and the other minister was from Cook's Island. And in her intervention, it was about climate change, and she started crying because she was sharing how her island was many parts of her island was being submerged, basically, and losing where her childhood home was. It's no longer existing because of rising sea levels. And at the same time, as a Minister of Health, she's seeing dengue virus, like dengue fever outbreak, more than she's never seen before. And the reason why she also felt very hopeless was that, and I remember her saying that we are suffering because of climate change and carbon emissions that we didn't contribute to. And that injustice is what always strikes me. Being in Egypt, and I'm very fortunate that while I do see the impacts and on the patients in terms of air quality, in terms of extreme heat, but the existential risk of losing land, losing culture, losing family members is so powerful for me personally to keep doing the work, because it's this summit is about human rights and it's about justice. And that's one of the things that I hope people understand, that yes, sometimes to transition to net zero, it needs a bit of funding, and it needs a bit of governments to stop thinking about the next year and to start thinking about the next 10 years. But they also need to consider like the historical responsibility of who's suffering and who contributed, who's paying the cost, who's bearing the brunt, and what are they doing to protect these people. And we have a duty to them. And it's not just small state islands that are so far away from us to live their reality. It's also, I'm sure, many communities here in the UK and in Egypt and in other countries. But also there are stories of hope. And on the other hand, in my team, I was supporting a group of young people who established a tribunal where they were gathering witnesses to describe how climate change is impacting their health and their communities. But this tribunal was created because only last year, the International Court of Justice is now developing an opinion on climate change, an advisory opinion. And this was it was single-handedly driven by the Pacific Student Island Alliance. So students pushed for it, and they pushed Vanuatu to push for that. And then the International Court of Justice had an open call for all countries to make submissions on what they think the impacts of climate change is on human rights. And our tribunal was there to gather evidence and stories and lived experience to feed directly into this process led by youth. And this advisory opinion will be a way to hold companies and governments accountable and also push them to act on climate change. And only a month ago, there was a case led by young people in South Africa where they wanted to open a new coal power plant. And then the government was like, well, you can sue us, we have to do it, it's for the economy, all of that, blah, blah, blah. And then they were like, okay, fine. They actually sue them. And they used the right to health, to clean air, the children's right to clean air. They won the case, and the coal power plant will not be opened. And these are like really powerful examples that I always see from people I have the privilege to work with.
Thanks for listening to this quickie.
This episode was created by our superstar podcast team at TEDxLondon. Until next time,
Stay curious.